8:14. God bless the people in Florida. They're getting ready to get hit hard by Helene. Here, we got a little taste of fall in the air today. A bigger taste tomorrow, which is good. No Arctic cold front on the horizon or anything like that. But it is going to be nice to have a break from the hot summertime humidity. It's Fall's Prevention Awareness Week in addition to being fall. And according to the Centers for Disease Control and Prevention, more than 1 in 4 older adults fall each year. But a lot of these are preventable. Dr. B, our friend Dr. Brent Wallis, Chief Medical Officer at People's Health, joins us now to share tips for staying steady and lowering your fall risk. How you doing, Dr. B?
Hey, Tommy, I'm doing great. How about you?
I am okay, sir. Thank you. And steady on my feet. Let's talk about fall prevention. Why is that so important?
Yeah, fall, thinking about falls is really important, especially for older adults, because the consequences can be so dangerous for them. It can cause a lot of serious injuries, things like broken bones or head contusions. We've even had people with internal bleeding. So it's a really serious condition. But then the other thing you have to think about is once you've fallen, it can be very difficult for people to stay independent, especially if they have an injury that prevents them from being ambulatory and getting up and walking around. And the good news is research shows over and over that the fall risk is actually controllable by things that we do.
I was saying it earlier, Doc, for people that have been through it with older parents, unfortunately, a fall can lead to shoulder troubles, hip problems, and from there it's just a cascade of downhill health. And if you can prevent it, Lord knows you want to do that. What are some of the things that raises the risk of falling?
Yeah, there's quite a few things, especially as you get older, that make you more likely to have a fall, and that includes a lot of health conditions that older adults can develop. In particular, things like foot injuries can cause difficulty, especially in balance. Older adults tend to have some balance problems, especially if they don't take steps to prevent that from developing. And if you're not sure on your feet, you're more likely to fall. And then as you get older, everybody probably knows your muscle mass decreases a little bit, and you can develop some weakness, especially in your lower body and your legs. That's going to make you at a higher risk for falls as well. And then we see in our older patients, often they develop a vitamin D deficiency, and that's because they don't go outside as often as they used to. Vitamin D deficiency can lead to fractures, so if you do fall, you're more likely to break a bone. And then the big one that we see probably most often is something called neuropathy. And neuropathy is a condition we see frequently in diabetics. It actually makes your feet feel numb, and so you have difficulty knowing where you're placing your feet, or when you do take steps, you may feel real, uneasy on your feet as well, and that can lead to falls.
Also, vision, I would think, plays a part in this.
Yeah, absolutely. Older adults who have trouble seeing are really probably about twice as likely to fall. So you want to make sure you're always wearing your eyeglasses or your contact lenses consistently, really so you know where you're going, you're not bumping into something or stepping on something that may result in a fall. And it's really important, too, to make sure as you get older that you get those yearly eye exams. Make sure you're keeping your eyeglass prescription up to date. And if you have a condition like diabetes or glaucoma or cataracts, keep in mind you really need to get your eyes checked annually, every single year. So if you haven't done that this year, you've still got time. Make sure you get out there and get your eyes checked.
Faux pas has become a metaphor for a gaffe, a social gaffe, but it actually means false step in French, which faulty vision can cause, where you think there's a step there or you miss one, and then before you know it, you're down and hurting. What else can raise your fall risk, Doc?
Yeah, another big one we see is actually medications. So there are certain medications that make you more likely to fall, especially the ones that affect you centrally. They affect your brain. And the most common ones are blood pressure and blood sugar medications. What can happen with that is they can actually make you feel dizzy or cause some confusion. So that's going to make it harder for you to stay steady on your feet. So if you're taking any of those medications and you're getting some of those side effects, you want to talk to your doctor about maybe adjusting your medication or even changing your medication to lower your fall risk.
I know I've spoken to a couple of people recently who had loved ones that fell not because of high blood pressure, but low blood pressure, so it can happen on either side, right?
Absolutely, absolutely. So, yeah, if you're on too much medicine, or maybe you were put on a medicine and then you lost a lot of weight, or you improved your diet, your pressure may go too low, and that could make you fall down.
What happens if you do fall, Doc?
Yeah, if you do fall, kind of number one is get the medical care you need, especially if it's something severe involving a break or you're bleeding. You may even need to call 911, but you want to make sure you address the immediate needs right away. But then this is so important, make an appointment to see your primary care physician. It's extremely important that you let them know about the fall, because one fall increases your risk for future falls. And so you want to talk to your doctor about the steps you can take to avoid another one. And then the other thing, too, is your primary care physician may want to check you for bone density. For example, if you developed a fracture, they may want to get a bone density scan on you to see if other treatment may be needed to make your bones stronger.
Some very valuable information from Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. It's Falls Prevention Week, and so much can be avoided if you just prevent that fall. If you do fall, do you have to slow down? Well, we'll find out when we come back. We'll also talk about prevention and more. 820 Traffic Now, WWL. 825, Tommy Tucker, WWL, back with Dr. Brent Wallis, Chief Medical Officer of People's Health, talking about fall prevention. Doc, if somebody falls, does that mean they have to slow down necessarily?
No, not necessarily. In fact, a lot of times after a fall, older adults may try to protect themselves by becoming less active, and that is really worse for you, because if you don't consistently move, you're going to lose strength and agility and that balance we were talking about. That all helps you keep you steady on your feet and actually reduce your chances of a future fall.
What about prevention? How can you lower the risk of falling?
Yeah, the biggest thing that you should be doing to reduce your risk of fall is exercise regularly. It strengthens your bones. It actually helps improve your balance and sharpens your reflexes as well. So if you do slip on something, you're more likely to catch yourself and avoid a fall. And you want to talk to your doctor about what are those safe exercises for you. It's going to be things that are pretty simple, walking, swimming, stretching exercises and stuff like that. You can really benefit from those simple home exercises.
And some other ways?
Yeah, the other thing we tell people about, if your doctor recommends a cane or a walker, make sure you use it. Some people can be embarrassed about that, but you absolutely shouldn't be. It's really important for your safety to prevent that fall risk. And the other thing is, don't put yourself in situations where you may cause a fall. Use a grabber to reach high items. Don't stand on a step stool, especially if you're unsteady on your feet. And then be smart about your clothing. You don't want to wear stuff that's baggy. You don't want to wear shoes that are slippery. And in particular, if you've got hardwood floors or non-carpeted floors, don't walk around in only socks, because you may slip and actually fall down and break something.
Any ways to make a home fall-proof?
Yeah, there are a few things you can do. More than half of the falls actually do happen in someone's home, so you want to make sure you look for things like tripping hazards, things that are laying on the floor. If you've got pets, they can definitely get up under you as well, so try to keep them calm and behave. That can be difficult. But, make sure you don't have any loose cables or slippery area rugs around. You want to tape things down to the floor so that you don't step on them and slip.
Some other ideas?
Yeah, some other things you can do, stairwells can be dangerous. Make sure you keep them really well lit. Make sure the lights are on when you're going up and down the stairs. And then you can even put a flashlight next to your nightstand. A lot of times we'll see falls in the middle of the night because someone's getting up to go to the bathroom. They're walking in the dark, step on something and slip. So that's a real easy tip you can use.
What about keeping the bathroom safe?
Yeah, the bathroom you really have to address. It's one of the most common places for falls. You imagine, because it's got a lot of wet, slippery surfaces in there. So you want to make sure you have a non-slip mat in your shower. You can actually install grab bars on the walls as well and within the shower. And then if you are really unsteady on your feet, get a shower chair. It's another way to prevent yourself from falling in the bathroom.
What about outside the home?
Yeah, so the people don't think about this always, but if you have steps leading up to your front door, make sure they're in good condition, that they're not uneven or have that they don't have broken bricks on them. You want to make sure that you keep all that debris out of your yard as well. Even something like a fallen branch you could step on, become unsteady, and actually fall down in your front yard. And again, lighting is really important. You've got to see where you're stepping, so keep your lights on at night.
And some final tips for avoiding fall risk?
Yeah, one thing people don't think about is getting enough sleep. If you're not sleeping well, you're more likely to be a little bit groggy, especially in the morning time, and that could actually increase your risk of falls. So at least 7 to 8 hours per night. And then think about things like alcohol in particular, limiting or avoiding alcohol because that can actually make you unsteady on your feet and sometimes impair your judgment. You may try to do things like get up on a ladder that you shouldn't. And then, when the weather is really bad, especially when we've got a lot of rain going on outside, that's going to make things outdoors slippery. So try to stay indoors when the weather is bad. You're much less likely to fall that way.
One thing I think that I remember telling my mom is that when you get up, take a second to get your bearings about you. Don't just hop right out of bed, right?
Yeah, definitely. A lot of older adults on blood pressure medicines, when you stand up, you can get a little woozy. So stand up, hold on to something, equalize, and then you're good to go.
It'll wait. Take a second, get your bearings about you. And also, you talk about step stools, Doc. They make them with the handles that rise up. You know what I'm talking about on the side?
Mm-hmm. Those can be very helpful, definitely.
So if you get an older parent. Thank you, Doctor. Very valuable information. Dr. Brent Wallis, Chief Medical Officer of People's Health. If you want to find out more about People's Health, I think we're going to be out there live in October. You can visit the People's Health Medicare Center in Metairie. It's at 3017 Vets, right next to Party City. Appointments are recommended, but walk-ins are welcome. Very friendly, very helpful. You can go to peopleshealth.com to find out more. You can call them at 1-800-978-9765. People's Health got a 5-star rating. They don't have a lot of those. They don't even have one for every state, but it's the only one in Louisiana. Go to peopleshealth.com. When we come back, we'll talk to Joe Giarrusso about New Orleans and Entergy and power dependability. Right now, though, a minute late, we go to WWL First News and Chris Miller.